Hello dear students, welcome back to the dental class. In this lesson, we will be comparing the inferior alveolar nerve block, the Gow Gate nerve block technique and Vazirani Akinosi nerve block technique. If you haven't seen my videos on all these three techniques, I'll mention the link of those videos in the description below. By starting the topic, the basic steps are the same in all these three techniques. The differences are on the basis of mouth opening, landmarks and techniques, anatomy, nerves that are anesthetized, and areas that are anesthetized. In inferior alveolar nerve block technique, the mouth opening should be normal. While in Gow Gate mandibular nerve block technique, the mouth opening needs to be completely wide open. And Vazirani Akinosi technique is a closed mouth technique. Now comparing the landmarks and techniques in these three nerve block techniques, the landmarks and technique in inferior alveolar nerve block is at the point of intersection of horizontal and vertical line. Horizontal line is 6 to 10 mm above the mandibular plane and vertical line is at 3/4 distance from anterior border of the ramus up to the pterygomandibular raphe. The intersection of these 2 points determine the needle penetration site. Now the landmarks of Gow Gate mandibular nerve block technique are, it has two types of landmarks, extraoral and intraoral. Extraoral landmarks is an intertracheal notch which starts from the lower border of the tragus on the side of the block up to the corner of the mouth on the opposite side of the block. And the intraoral landmarks are mesolingual cusp of the maxillary second molar and maxillary second molar distal side. Mesolingual cusp of the maxillary second molar determines the height of the injection, which is 10 to 25 mm above the mandibular plane, and maxillary second molar distal side is the needle penetration site. The landmarks of Vazirani Akinosi technique are mucogingival junction of maxillary third molar, maxillary tuberosity, and anterior aspect of the ramus. In this technique, ask the patient to gently occlude, visualize the landmarks, and direct the needle posteriorly and slightly laterally while parallel with the maxillary plane and adjacent to the maxillary tuberosity at the level of the mucogingival junction of maxillary second and third molar. Now comparing the anatomy of these three techniques, in inferior alveolar nerve block, the needle penetrates the mucosa, the pterygomandibular raphe, and then inside the pterygomandibular space, which contains inferior alveolar nerve, inferior alveolar artery, and inferior alveolar vein. While in Gow Gate mandibular nerve block technique, the needle passes the mucosa, submucosa, and between the temporalis muscle laterally and lateral pterygoid muscle medially and superiorly. It reaches the lateral side of the condylar neck above the maxillary artery. In Vazirani Akinosi nerve block technique, the needle will pass the mucosa, submucosa on the medial side of the ramus and travel between the ramus and the medial pterygoid muscles towards the target area above the inferior alveolar nerve, lingual nerve, and mylohyoid nerve, which is at the mid portion of the pterygomandibular space. By comparing the nerves that are anesthetized in these three techniques, in inferior alveolar nerve block technique, the nerves that are anesthetized are inferior alveolar nerve, lingual nerve, and mental and incisive nerve. While in Gow Gate mandibular nerve block technique, the nerves anesthetized are inferior alveolar nerve, lingual nerve, buccal nerve, mylohyoid nerve, auriculotemporal nerve, mental and incisive nerve. In Akinosi Vazirani technique, the nerves anesthetized are inferior alveolar nerve, lingual nerve, mylohyoid nerve, mental and incisive nerve. And the areas which these nerves supply and automatically anesthetized by these nerve block techniques are, in inferior alveolar nerve, the area anesthetized are mandibular teeth up to the midline, body of the mandible, buccal mucoperiosteum and mucous membrane anterior to the mental foramen, anterior 2/3 of the tongue and floor of the mouth, and lingual soft tissues and periosteum. And the areas that are anesthetized by Gow Gate mandibular nerve block technique are mandibular teeth up to the midline, body of the mandible and inferior portion of the ramus, anterior 2/3 of the tongue and floor of the mouth, lingual soft tissues and periosteum, buccal mucoperiosteum and mucous membrane both anterior and posterior to the mental foramen, and area lateral to the cheek and in the temporal region, which is supplied by the auriculotemporal nerve. The areas that are anesthetized by the Vazirani Akinosi technique are mandibular teeth up to the midline, body of the mandible and inferior portion of the ramus, buccal mucoperiosteum and mucous membrane anterior to the mandible foramen, anterior two-thirds of the tongue and floor of the mouth, and lingual soft tissues and periosteum. These are the basic differences between these three techniques, and now you can decide which technique is suitable and when, and which technique is more technique sensitive and which is easily learned. Thank you for listening to me, and don't forget to like and subscribe. Goodbye, take care.